Todd Stepaniuk, and I have the pleasure and privilege of acting in the capacity of President and CEO at the Middlesex Hospital Alliance. And this morning, joining me is Dr. Gary Perkin, Chief of Staff of the Middlesex Hospital Alliance, as well as Don Butler, Board Chair of the MHA. And we're here this morning to speak to you with regards to an exciting new development at the MHA, and that is the recently minted inaugural Clinical Services Plan for our dynamic organization.
The Middlesex Hospital Alliance Board completed a 5-year strategic plan, and from that plan our mission was to provide the health care we would expect for our own families. And as a result, quality of care was one of our strategic pillars. But at the same time, we knew we had to manage our resources within the limited budgets that we had. To be able to manage those resources and still provide the quality of care that our community wanted, the board embarked upon a very comprehensive clinical planning process. We knew we had to set the priorities today and in the future for what the community needed for our healthcare system. The board struck a clinical steering committee, and then that steering committee populated 4 clinical panels to look at obstetrics, surgery, medicine, and emergency and ambulatory care services. The panels were made up of 12 to 20 people, and they were made up of physicians, staff, community members, and community partners. Each panel worked to review the current priorities. They also reviewed the current forecast for both population and for programs. Then they set some short-term recommendations that went forward to the board, as well as a long-term vision of what the clinical services should be for our community and in our hospitals. Gary would like to speak now about the outcomes of each of those panels.
Thanks, Don. As Don mentioned, there was 4 panels looking at 5 different areas within the hospital: our medical program, obstetrics, surgery, and 1 panel that looked at emergency and ambulatory care. Within the medical program, we have a number of dedicated family physicians who provide inpatient care for not only their patients, but orphan patients as well. This is an absolutely essential program for our hospital. We want to strengthen and maintain this. We have 2 psychiatrists that work at the hospital, one that is retiring very shortly, and we want to continue and, if possible, strengthen access to mental care for our community. Especially at 4 counties who have a dedicated palliative care room, we want to develop a standardized approach to palliative care. Within our obstetrics program, we want to expand our obstetrics program to include a full-time OB/GYN, and effective April 1st this year, we were successful in doing that. Dr. Niyarika Chandra has joined the staff of our hospital as the first full-time OB/GYN we've had here in probably 30 years. We also want to ensure there was around-the-clock, 24/7, 365 coverage for cesarean sections. Within our emergency department, we have a 24-hour emergency department staffed by a combination of family physicians and full-time emerge physicians. It is essential for our community to maintain the full 24/7 ER coverage. We also want to improve our patient experience in the emergency department, improving patient flow and length of stay within the emergency department itself. We also have opportunities for developing collaborative care strategies through CCAC, CMHA, the local mental health crisis team will attend Emerge. We want to expand these links to provide more comprehensive care to patients who show up in our emergency department with a wide variety of issues. Our surgical program, we have 6 surgical specialties. The board would like to maintain these specialties. There is a consideration of expanding general surgery at the Strathroy site and providing colonoscopy and gastroscopy services at 4 counties, and possibly adding some outpatient surgery in our sister hospital in Newberry. We want to continue to pursue surgical innovation and excellence. Our surgeons do minimally invasive procedures, which is modern state-of-the-art care. Within ambulatory care, there are a number of clinics held here by our specialists to provide follow-up care for those having in or outpatient surgery. We would like to improve the use of telemedicine within our ambulatory care and hopefully expand visiting consultants so that patients can receive specialist consultation and care without having to travel elsewhere. So that is a summary of the priorities and vision that we see within these 5 different areas, both in Strathroy and in 4 counties.
So as Dr. Perkin and Don have eloquently articulated, the clinical services plan truly sets out the aspirations for clinical services at both the Strathroy site and the 4 county site, as well as identifying measures that need to be taken and adopted to drive those important initiatives to enhance and augment clinical services at the MHA. And in many ways, the development of the clinical services plan represents a significant achievement for us at the MHA. It's an important milestone in our journey in terms of delivering on our strategic plan, as well as our many strategic priorities and imperatives. However, as Gary articulated, as the focus shifts to implementation of the clinical services plan, the challenging journey towards realization of the benefits of the plan are really just beginning. As we as an organization move forward to realize an action for the betterment of our community, the clinical services plan, the plan is going to be guided by really evidence-based clinical practices, business planning development, cost analysis benefit, human capital, as well as planning. So as a simple example, we need to ensure that the alignment of our budgets truly do align with our clinical service priorities going forward, and that any resource allocations really mirror those clinical priorities. We recognize that our plan as well involves many long-term and complex initiatives. So we have short-term, medium-term, and long-term. And this plan will be successful through the ongoing engagement of our MHA family, which includes our staff, our physicians, our volunteers, our trustees, as well as you, members of our public.
On behalf of the Board of Directors for the Middlesex Hospital Alliance, I want to extend my sincere appreciation and thanks to everyone that participated in this process. It was a year-long process. We had a lot of people who participated in the panels and the steering and gathering information for us, and we just couldn't have done it without you. But we know, as this plan's rolled out over the next 10 years, that we are really going to be able to serve the needs of our community and the health care that we would expect for our own families. Thank you.